The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I am being joined by Dr. Jared Chapman of Living Well. Dr. Chapman, thanks for being with us.
Thank you for having me, Shay.
A couple of weeks ago, we started a conversation about a procedure that you performed there at Living Well, microneedling. And we're going to continue that conversation a little. We're going to go a little more in depth today because you have a procedure there that takes it a step further, and that is called Profound. Is that correct?
Correct.
And can you tell us exactly what that is and what the difference is between Profound and just basic microneedling?
So we talked a couple of weeks ago about microneedling, and that's a very much a lighter treatment, very, very small needles that kind of stimulate the skin on the surface. Profound actually goes deeper into the dermis. So it is microneedling. The needles extend, though, further down into the dermis. Then we release energy on top of those needles. So we actually heat that tissue to about 67 degrees Celsius for 3 seconds. And the reason we do that period of time and at that temperature is because the studies showed that microthermal damage that's being created at that point is enough to stimulate collagen, elastin, and hyaluronic acid.
All the three things we need the most, right? to look youthful.
And it's really the only device on the market that's actually been shown to stimulate all three in the studies that were done. And it's also been shown to have continuous feedback looping on that monitoring of that temperature at that time. So the device knows exactly not to exceed that temperature in that spot where that needle is located for more than 3 seconds. So it's a very simple procedure. The results are amazing. They're not instant, though. If someone's looking for something instant, that's more of a filler or Botox type thing.
Right.
More of a long-term process. Usually takes about up to 6 months to see the full results after treatment. We notice changes in the skin as early as 4 to 6 weeks, and that's usually when we see the patient back the first time.
Okay.
This procedure does have downtime with it, so we like to make sure the patient is well aware that it will take about a week to 10 days for the swelling and bruising to go down, because there will be swelling and bruising with this procedure. But it really is the only thing on the market that is effective, that I have seen on the market, as effective at treating the neck and the jowling area. It's amazing how well it targets that area and usually produces an awesome result. The studies show that there's a 100% response rate. Now, the degree of response varies from person to person.
Sure. Mm-hmm.
But there is 100% of the time we do see an improvement. It's just, the significance of improvement does vary. But most of our patients are extremely happy with their Profound treatment. They love the results. It gives you about 30 to 40% of what a facelift would give you. So we don't, if someone comes in with severe laxity and sagging, that person probably needs a facelift.
Right.
Money on this is not really going to get them to where they need to be. So we have to assess the patient very carefully in the consult that we do with them and set the expectations of what they can expect to see with a non-invasive procedure. But Profound truly is one of the best non-invasive treatments that I've seen for the face and neck regarding aging.
And you said, again, about how many treatments typically does it require to see a...
Just
one time. Just one time. Okay. That's great.
1 hour to treat the face and neck.
Okay, so not bad, not bad. And then on a scale of 1 to 10, what type of pain or discomfort?
So we anesthetize the area with lidocaine, so we infiltrate that area, and that's probably the most uncomfortable portion of the procedure because there's a lot of stinging and burning from the lidocaine as it goes in.
Right.
Them completely anesthetized. They don't feel anything to do with the microneedling usually.
Wow, very good. All right. Well, Dr. Chapman, great information as always. We thank you so much for being with us, and we look forward to our next conversation.
Thank you for having us.